Hello, my name is Sarah Stewart, and I will be presenting on HIV and AIDS. So some objectives we have is going to be the HIV/AIDS impact on U.S. population, etiology and risk factors, pathophysiology, clinical manifestations and complications, treatment, and nursing evidence-based practice. Okay, so impact on the U.S. population. About 1.2 million people in the United States have HIV and roughly 13% don't know they have it. Most HIV cases, nearly half, occur in the South and are not even throughout the states. People 13 to 34 accounted for over half, 56%, of new diagnoses. Men who have sex with men make up the majority of the population of those with HIV. In 2022, there were 19,310 deaths among those infected with HIV. HIV treatment can range from about $430K to $1 million. Okay, so let's talk about the etiology and risk factors of HIV. So etiology is going to be the cause. So HIV is spread throughout direct contact with bodily fluids such as blood, semen, or breast milk. This can occur through if a nurse is taking blood from a patient and she has a cut on her hand and the blood gets in the cut, that could happen. Semen from sexual contact, breast milk or other bodily fluids during birth. So HIV is caused when the virus enters a person's body and attacks the immune cells. So we have CD4 and T cells. Those are our immune response cells, and that is what the HIV, the retrovirus, is attacking. The body is more susceptible to other infections and is less protected because these cells are being damaged. When left untreated, HIV progresses into AIDS. Risk factors include unprotected sexual intercourse, which is something modifiable that we can control, multiple sexual partners, previous STDs, sharing HIV drug use needles, so those are all modifiable risk factors that we can control and prevent HIV. And maternal HIV infection for newborn infants and children, which are not really modifiable. In some cases, they might do a C-section to try to control the environment more and prevent the crossover from the mother to the newborn. And then with breast milk, you can give your kid formula instead. Okay, so now let's look at the pathophysiology. So we talked about the CD4 and T cells that are responsible for immunity. So the cell is injected with RNA from the retrovirus. So the HIV is going to mutate the RNA strand. So then the RNA strand is going to turn into DNA, which creates proteins known as provirus. And these variations infect other cells and cause genetic mutation in the body. The immune system becomes very weak because of the destruction of immune cells. When the CD4 and T cells drop below 200 cells per ml, HIV has progressed into AIDS. And if you look at the picture below, you can see the T cell, you can see the HIV cell, and you can see how exactly it attaches itself onto this T cell. So the GP120 from the HIV is attaching onto the CD4 receptor, and then that co-receptor is on the side of it as well, so that's attaching to it, and then once it attaches, it injects itself with the RNA. Alright, then once the person is infected, clinical manifestations will show within 2 to 4 weeks. So some short-term symptoms from acute HIV could include fever, fatigue, muscle pain, skin rash, headache, sore throat, swollen lymph nodes, joint pain, night sweats, diarrhea, ulcers in the mouth, lips, nasal area, or peritoneal area. So those are some acute symptoms that we could see. Some people might not have symptoms at all, so it goes unnoticed, or if it's not treated, then it could turn into chronic HIV. So some later symptoms include nonspecific fatigue, persistent generalized enlarged lymph nodes, oropharyngeal candidiasis, which is like fungal in the mouth, Oral leukoplakia, which is pictured below. You can see the bacteria on the tongue, and it kind of looks like that hairy tongue. So because of the genetic mutation and decrease in CD4 and T cells, people with HIV and AIDS are more susceptible to cancer and infection. So opportunistic diseases may attack the body as it's weak. For example, tuberculosis. Tuberculosis is a disease, respiratory disease, that a lot of people with HIV die from. HIV may also hurt one's organs, such as the heart, making one more susceptible to acute myocardial infarctions, heart attack, stroke, peripheral arterial disease, heart failure, and sudden cardiac death. Other complications may include encephalopathy, non-Hodgkin's lymphoma, ocular, also known as eye disease, peripheral neuropathy, meningitis, and cerebral toxoplasmosis. So what do we do when we have an infection with HIV or AIDS? So art therapy is the treatment recommended for HIV and AIDS by the WHO and CDC guidelines. This treatment should start after diagnosis is confirmed. However, opportunistic infections may delay treatment. Art therapy includes the person taking multiple medications on a specific schedule to suppress the virus. Common medications given include NRTIS, which is nucleoreverse transcriptase inhibitors, and non-nucleoside reverse transcriptors and integrase inhibitors. So these are all going to work together to suppress the immune system and hopefully get rid of those viral cells. Okay, so then let's look at the nursing evidence-based practice. So the ANAC is a nurse association against HIV and AIDS. So within the RN scope of practice, they have an essential role in caring for patients with HIV. RNs can educate clients on the importance of taking antiretroviral therapy consistently, which is crucial for decreasing the viral load. Nurses also assess clients for mental health concerns, substance use, and social barriers such as housing or food insecurity, which can impact care adherence. So for example, if a patient doesn't have transportation to and from doctor's appointments, there are resources within the healthcare system that will provide rides, so that way patients can go get lab testing and everything they need. Nurses can also ensure patients are up to date on screenings and immunizations to prevent opportunistic infections such as TB. So it's like having your flu shot. Harm reduction strategies can be taught, including safe sex education and needle safety are essential nursing interventions that help reduce HIV transmission.